Hi, I'm Christine Baker from the New London County Elder Care Channel. We're here today with Nancy Lisee from Senior Resources. Hi, Nancy. Thank you for
Hi.
joining me.
Thanks for the invite. I
Absolutely.
appreciate it.
We're just going to go over some questions and get some information about what Senior Resources is, some of the programs that they offer, where they're located, and just have a nice conversation and get that information out to our viewers.
Great.
Where is your location?
Actually, we're located in the Norwich Industrial Park, 19 Ohio Avenue, Suite 2. It's right off Connecticut Avenue. You can't miss us. But the beauty of it is we're located with our network partners, the Alzheimer's Association, Chris Radio, Disabilities Network of Eastern Connecticut, are all located with us. So it makes a nice,
It's like one-stop shopping.
right. When you walk in, somebody there can help. So it's just great to have. It takes a village, and we have it.
That's great. Now you guys weren't all together at one point in time. I think you were separated.
We were. The Alzheimer's Association joined us when we were in another location in Norwich. When we moved, they moved with us, and then we joined with other partners. So it's just a good cohesive group, and the services are like seamless. So
and they overlap.
That's correct.
Okay.
So it's important for the consumer walking through the door that their needs are met.
Okay. Now, do you see most of your consumers in the office, or do you go out?
We see a number of them in the office. However, we do have satellite offices. I'm in Middletown a couple times a week, providers meetings, and I see clients there as well. When it comes to folks that need our services that are homebound, we do make home visits. So that's important. We have a great program. It's the benefits checkup. It is the most, I want to say, time-saving program I think that was ever made. It's web-based, and it's based on zip codes, so they don't ask intrusive information like, what's your address? They'll ask your zip code.
Mm-hmm.
They'll ask your month and year of birth. And after you answer all these different questions, what actually is produced is a list of services, whether they're state programs and services, federal, or even local. You've not enrolled into anything, but it gives you the parameters of what you can apply for. And then we offer application assistance and follow-up as well. The beauty of that program is, and I'm just giving an example, if someone wants Medicaid, first of all, it's important to know there's like 84 different Medicaids in Connecticut, all waiver programs. Some are straight Title 19, some are long-term care, some are community, some of them are extra help with your Part B premiums, the Medicare Savings Program.
Mm-hmm.
It screens for all of those, and it screens out, it doesn't even show on the list, if in fact you don't even fall into the parameters. So that way you're not wasting time applying for a program you're never going to get.
Right.
So it's a nice, useful tool, and it's a time saver as well.
And that website, I know it by heart because I absolutely use it every single time I send out information to my clients, the Benefit Checkups program.
Absolutely.
So that they can go through that and reach out to people that they could possibly use services for.
And the useful thing about the tool, we have a flyer. If you flip it over, it asks for the specific things that you're going to need to know when you do the screening. So it's not only an issue, they ask you like parameters of your income. Do you make more than $4,000 a month? Do you make less than? So these are things you're prepared to answer, and we do it right in the agency. And we have different senior centers that supply that service as well. So it's important to know it's just a checkup. If you're getting everything that you're qualified for, it's almost like a confirmation tool.
Mm-hmm.
But if there are things out there that you don't even know about, it just helps folks to get the services they need to remain in the community and be independent and have quality of life.
And I think things change constantly. So it's always something good to go back and check on and make sure there's not something else that's out there that you can benefit from.
Absolutely. Every legislative session changes. Sometimes income guidelines change. It's just important to know. So that's one really key piece of what we do at the agency. We find that our respite programs for caregivers are in such high demand. We have two respite programs, and we say respite, it's actually respite for the caregiver because the person being cared for gets the paid services. And then the caregiver gets to do fun things like go grocery shopping, go to the pharmacy, do errands, go to the bank, or sometimes they actually go to lunch with maybe a son or daughter or socialize just to give them quality of life. But the program pays for adult daycare services. It even offers short-term skilled nursing facility stays, like for our Alzheimer's respite clients. The family wants to go on vacation, but they want to make sure that their mom is well cared for. She may need almost 24/7 care. So we will pay short-term in a skilled nursing facility so that family can go on vacation and actually have, some respite consecutive days for it. And the other one, the National Caregivers Family Support Program, that addresses folks that do not have a diagnosis of dementia or other related Alzheimer's or cognitive issues. This helps just the spouse maybe caring for an older spouse or a son or granddaughter caring for, their loved ones. And it pays for adult daycare. It pays for a number of things, but it's caregiver driven. That's the beauty of it. We don't tell the caregiver what they should do. They tell us we need like maybe special equipment that's not covered by Medicare. Part of that National Caregiver is a supplemental piece. For instance, some folks need special lotions or maybe adult diapers or something that is not covered by insurance. The caregiver tells us what they need, so we pay for it. One thing that just came up, I thought was pretty unique, is one of our caregivers that was caring for someone that was blind wanted a mixer for the hot water so the person she was caring for wouldn't burn themselves or scald themselves in the shower. So we were able to pay for the mixing valve. Of course, we're not that talented in the agency. We didn't go and install it, but we paid for it. So we really do a lot of good with the pot of money that we have. And again, it's to address the caregivers' needs. So they typically know what they want and know what they need. Transfer benches, for instance, Medicare doesn't pay for those.
They don't pay from anything from the bathroom door in.
That's correct. If it's a wheelchair, durable medical equipment, yes, they will certainly pay. But the items of convenience, as they're called, are not covered by Medicare. So our job is to serve our constituents, which is typically people 60 and over. And we typically do that through the money that we get through the Older Americans Act, which that National Caregivers Family Support Program is part of that.
And that's a federal program?
That's a federal program.
And one thing I wanted to mention, only because I know it's been mentioned a lot by Peaches Quinn.
Yes.
With respite, a lot of people don't really know what respite is.
Exactly.
And how she puts it is it's short breaks.
It is short breaks.
And that's what it means, is short breaks.
It's a break from caregiving.
It is, and it's absolutely necessary. In order to be the best that you can be, you absolutely need time to yourself so that you can come back, refreshed and ready to tackle the next day.
The caregiving responsibilities. I remember one caregiver saying to me, she said, it's like water in a well. If you don't put water in the well, then there's none to take out to give to somebody else. So refreshing herself was the only way she could carry on. And again, it's a 24/7 job that she was in. So that little short break, she certainly appreciated. I mentioned with Older Americans Act money, it's geared to 60 and over. However, we have a Choices program. Choices helps, especially during this time of open enrollment, it helps folks with their Part D plan from Medicare, which pays for prescription drugs, or if they're looking for a managed care plan, we screen for those because the key to a managed care plan is the prescription drugs should be covered, otherwise it's not a good plan for you, and your doctors should be in the provider list. So those are the key pieces that when people come in to us, we screen for that to make sure the doctors are on there, to make sure folks know the difference between Medicare Advantage and traditional Medicare and the parts that you need with that. Because if you're on traditional Medicare, you need a Part D standalone plan. And if you want a supplemental plan to pick up the things that Medicare doesn't cover, for instance, Medicare Part B is 80/20. Well, if you're looking for a plan that's going to pick up that 20% or pick up the Part A deductible or the Part B deductible, that these are decisions the clients make. We sell absolutely nothing, but we certainly explain what their options are. We don't tell them what to do. We just guide them in the sense of this is the product that you're purchasing. And what I find interesting with the supplemental plans, they're standardized. So the coverage is standardized, but the premiums are not.
So they're all across the board,
Absolutely.
but they all get the same service.
They get this, if you, Plan A, whether, regardless of who it's offered by, is exactly that coverage, the 20% copays. That's all Plan A does. Plan B pays like the Part A deductible and the 20%. So it's like a mix and match, and folks choose what they want. But when you look at the premiums, that's where, separate the boys from the men, so to speak,
Right.
because you could pay up to $549 per person for a plan that you can get for $250. So when we explain to the consumer, you're not going to get any more just because you're paying more. And we as Americans feel you pay more, you get more.
Mm-hmm.
It's not true with the standardized plans. So, and again, we don't sell anything. So our job is to watch out for the consumer, and we do really try to do that.
Now, do you direct the consumers to agents that do service this, or is it strictly up to them to find their own agent, but they're just giving the information?
Well, we get awesome sheets from the Connecticut Insurance Department. Basically, for every certified supplemental provider, there's an 800 number. So when the client calls to get an application, they're hooked up directly to the agency of their choice that they're calling. For instance, if it's Blue Cross Blue Shield that has a supplemental plan, they get their number, and then they take it from there. They usually request an application, and if they need assistance filling it out, they usually come back to the office, and we help assist with that. The only thing we can directly enroll a consumer is for Part D, prescription drugs. We do it right on the www.medicare.gov site. Of course, they already have to be on Part A and or Part B. But when they need prescription drugs, we can enroll them. We can't enroll folks in Social Security, which a lot of them come to the agency and think we're able to do that. The only way to enroll in Medicare Part A and B is through the Social Security office. That's the only avenue. So once that's done, they come to us and we try to, go explain the meta mess.
Which is really a good term.
It really is.
It is, because it changes constantly. You never know whether next year's going to be the same or last year's very different.
And the plans all changed names. Connecticut changed from, I think it was Prime, and now there's Passage or Plan 1, 2, and 3, and it confuses folks.
And some of them were actually pulling out of some of the programs.
Absolutely.
Within the state of Connecticut.
Yeah, and some of the providers don't accept certain managed care plans. Some of the hospitals. So that's when a person is looking for managed care, that's the first thing they need to look at. Are all the hospitals in Connecticut on that plan? Is the hospital that you use, whether it be Bacchus, L&M, Day Kimball, Middlesex, Memorial, are they in your plan? That's a big question to ask.
Okay, and you'd help them with all of that.
Absolutely.
What the right thing
Absolutely, we do.
I'm sure that not all of the providers that they use are in every plan, but you'll definitely give them the one that gives them the most of their providers.
And again, it's up to them, because the last thing I want is someone to call and say, Nancy Lisee said this plan was the best for me and now I hate it.
And now can you change it during the course of the year?
Well, some folks can and some folks cannot. People that are on the Medicare Savings Program or other government programs can change each and every month. But for those folks that don't have that level of protection, that's why it's called open enrollment. Once they enroll in a plan, which Open enrollment starts October 15th and ends December 7th. Once they enroll in a prescription drug plan and or a managed care plan, if they don't have that level of protection, they're locked in up until the following year. So once it becomes open enrollment again, just because you're enrolling in October, your benefit only starts January 1st. So that literally means for folks, they're locked in for a year.
Okay.
So
Now, is that donut hole still
oh
part
yeah,
of
it's
what
alive and well, but
it
it's
is?
closing
Okay.
slowly. I'm not sure what the future of the healthcare law will be, the Affordable Health Care Act, but that does for Medicare beneficiaries close that donut hole each and every year. So by the year 2020, that is going to be almost disappeared. So that's interesting to know. But if the health care law changes, then we're back to square one with new rules. So when you said things change each and every year, or not even that, just keep changing, we'll probably be facing those kind of issues in 2017.
And they can call you any time of the year, and not just during
Absolutely.
that time frame, to get some advice on what they should be looking for the next year.
Yes, they can. And sometimes it's good news and bad news. Sometimes they're able to change their plan due to some exception, and sometimes they're not able to change their plan. But it's better to know exactly, accurately, what your choices are. Because even if they can't change their plan, maybe there's other options, other providers that they can turn to get their needs met. But it doesn't mean it's a formal disengagement from the plan or re-enrolling in another plan. So sometimes the answer is no.
Okay. And anybody can come to Senior Resources, and if you don't offer that service, you'll direct them to who can offer that service for them.
Absolutely. A lot of times we get people that they're adults, they're not older Americans, and they're looking for services that through the Older Americans Act, if we can't provide those services due to age, then they can get consultation even with Disabilities Network or the Alzheimer's Association based on what their issue is. So at least with that network of the level of resources that we have some pretty smart people working there. Joan Marshall, Joyce Goodkin, my boss is very up to date on what the legislature's doing and which direction the agency should go. Now you couple that with other smart people from other agencies like the Alzheimer's Association, like Chris Radio and Disabilities Network. There's a lot of on-staff resources right there that we brainstorm. It's almost like the multidisciplinary teams that we have.
Yes.
It's the same thing at Senior Resources. If somebody comes up against a unique situation, we brainstorm at a staff meeting, how can we help this person?
So it's not just, I'm so sorry, we can't help you.
That's correct. Right. Or it maybe isn't us that can help. Maybe it's United Community and Family Services, or maybe it's TDCCA. But with that level of knowledge about what's out there, and with the help of that benefits checkup, it just ties, everything right in where folks aren't calling 4,000 places when they can make one call. Mm-hmm. So we try to address that concept of no wrong door. Sometimes it works, sometimes the door's wrong.
Right. Well, when Disabilities Network was here a little earlier, and we were talking about sometimes just knowing that information long before you need it.
Absolutely.
Is important. And waiting to the last minute when it's a crisis mode, you make wrong choices, wrong decisions, and things are put in place, and then you're stuck with them. Absolutely. Because you didn't have that information. So it's good to look for that information sooner than later.
That is such a profound point that you made, because failure to plan is like the number one crisis, because now there's not enough time to tease out what it is that you can do and what it is that you can't do. And now you're in a situation, you're trying to protect assets, you're trying to figure out how to live on the money that you know you're going to have, but you're in a crisis mode now. So it's very difficult for folks. Mm-hmm. And when you're in a crisis, coupled with ill health, you make poor decisions.
Absolutely.
So
absolutely.
I like that point that you made.
I'm looking here, and it says, just a question. Tell me about what you love about what you do and how you think you make a difference, just you personally.
I love what I do every single day. I've been working at Senior Resources for 28 years, and I never had an unhappy day there. And this is the reason why. We have the tools, we have the programs. I think of the Medicare Savings Program. We have saved folks a boatload of money just by knowing about this program. The biggest highlights of what just recently happened is an older client came with a nursing home bill that was in excess of $7,000. She had insurance, and they were just kind of giving her the go around. And for whatever reason, it wasn't that, divine intervention. It wasn't me.
Right.
But just sending them a letter outlining what the client had done, and that should be enough empirical evidence. They should refund her money. They did. They refunded her money. And recently, there was a client that enrolled in a supplemental plan, but the people on the other end enrolled her in a less expensive plan. She never utilized services, but when she came to the agency, she was talking about our plan. We took a look at it. It resulted in a $3,000 rebate for that client. Now, if she'd not come to the office, that would have gone unnoticed for who knows how long.
Right.
And it's helped. Just the education that we do with our presentations to the community. A couple came in saying that she was in hospital, Medicare paid the bill, and now they got a supplemental bill for room and board, and she's a Medicare patient. It's like, no, there's no supplemental for room and board. Medicare paid your hospital bill. You do not owe that supplemental. We sent out a little notice saying, by the way, this is illegal, and went away. The bill disappeared. So we do advocacy on a personal level, especially when it comes to our clients presenting, but we also do advocacy for our programs to help avoid some cuts, because when you cut a program, it's not just dollars you're cutting. It's consumers not getting the services that they need.
Mm-hmm.
And that's really the sad truth about the economic environment that we are living in
at this point in time. Absolutely.
But another thing that saves folks, and I'll conclude with this, is it's called the Medicare Senior Patrol. And what that does is it explains to consumers the scams that are going around out there. I know the grandparent scam, that was in Connecticut about 20 years ago. It went away, it's back. It went away, it's back. It keeps coming back because it's effective. And now with the onset of computer dating, online dating, we're seeing what we term sweetheart scams.
Absolutely.
People are getting built over, situations like that. Credit card scams, telemarketing scams, just the matter of healthcare fraud. Reading what your Medicare summary notice, being able to read that and actually understand it and put together the pieces of evidence that you need if you feel that you're not being billed correctly. And just teaching somebody the data service is the whole key to tracing the paper trail. People get mail, they get a statement date. They get this date that it was mailed on, when it came. But that's not the date of service.
Right.
So that date is almost like irrelevant. It's when you got notified. And it's the same thing when folks look at their credit card bills. They only get the notification after the fact. So if they're not looking at their statements, picking out what went wrong, they're going to pay a bill that they don't owe and pay for services they never received. So we just try to couple education with, our assistance to get programs, to keep programs, and to help folks stay on the programs that they're entitled to.
And I think with people living longer, healthier lives, that's important because as we grow older, I know just with my mom, she gets her Medicare statement in, and sometimes she thinks it's a bill.
Yes.
And I have to explain to her that it's not a bill. It's just letting you know what Medicare, what you've been paying for from working, that your, benefit is paying for it and what the money's going
Absolutely.
out for.
These are why we love people like you, because that's ambiguous too. You get the Medicare summary notice in big note and big letters. This is not a bill, but it does say you owe.
Right.
So people want to pay that. And it's like, no, you don't pay it until you actually get a bill, because this is only telling you what Medicare did. It's not telling you what your supplemental plan did, or if you have employer's package or something else, you're going to get a separate statement from them saying what they paid. So all those papers should add up. If you do owe anything, it should all be the same amount. Medicare says it's XYZ. Your supplemental plan says it's XYZ, because it could be a non-Medicare covered service.
Right.
And then you get a bill, but you don't pay from the Medicare statement.
And I think a lot of people do.
Well, they see it and they feel that they owe it, and they're honest, and they want to pay their bills. So,
right. And it's frightening, because I think people, they do that and they deplete their funds unnecessarily for services they actually could be getting and paying for by paying something that really isn't needed to be paid at that time.
Absolutely. So don't pay for anything that you're not absolutely certain that you should be paying.
Okay. You did answer the question about the special client story. I think you had a couple of them in there, but if you have another one, I'd love to hear it. Just a particular client that was a favorite to you that you worked with and maybe made all the difference in the world to that one person.
There is something. I had a client for 25 years, because
the same one.
Yes, it wasn't that it was a success story. It was several little success stories. First, when I first met them 20 years ago, they needed housing. So we helped them with the housing situation. They got housing. Then you establish a relationship. Then they came back to the agency because they were billed inappropriately for that room and board. They came back to the agency. We helped them with that. And throughout the years, and I have to say, I feel bad because the gentleman had passed, but his wife still comes to the agency for all her Part D stuff. She comes to the agency for her needs. Sometimes she comes to the agency just to sit and have coffee. So we try to do that too. The thing that I like about my agency is when you call during business hours, you get a person. You don't get dial 3 for this or dial 2 for that, or just hang up. So it's a warm, friendly atmosphere, and all staff is dedicated to serving our 56 town region.
So you do 56 towns in the state of Connecticut.
To the best of our ability, but when I say we do it, we don't do it alone. We have partners that we rely on, and we try to be a good partner too.
Now, is the locations that you cover in the state of Connecticut the eastern section of the state?
That's correct.
Does it go to the north?
It's all of Middlesex County, Wyndham County, New London County, and 5 towns in Tolland County. That's our area. So Hartford, for instance, has its own area agency because there's 5 of us in the state.
Right.
We're eastern. Hartford, we call it North Central. Then there's South Central. There's west, the western area, Litchfield County and all of that, and New Haven, South Central. So
and they all provide the same services that you provide.
Well, some provide even more because we don't do the home care program. That's done through CCCI.
Yes.
The home care program for elders.
Yes.
We don't regulate that or do it. But South Central does. They have that all incorporated in what they do. So even though we do similar things, we do it different because our demographics in Eastern are so different from those in New Haven. That's a metropolis there. Out of the 56 towns we serve, 47 of them are rural. So you're looking at Thompson, Plainfield, Canterbury. That's a whole lot different than Middletown, New London, and Norwich.
Right.
So the way we get information out there differs than if you have a big dynamic. We have the most geographical area, but a smaller dynamic of 60 and over. because it's rural. So maybe have like 2,000 people in one little hamlet, whereas, in New Haven, you probably have, 20,000.
Right.
So,
Now,
yeah, so it's a big area.
You brought up how we can reach out to you. What's the best way to contact Senior Resources and directly to you?
Yes, the best way to contact us is through our own 800 number, which is 1-800-690-6998. Because on our choices brochures, there is an 800 number, but that's geared to what area you're calling from. So if someone in Hartford wants to reach me, he can call that 1-800-690-6998. But if he calls the 800 number on the brochure, he's going to get the North Central Area Agency. Not that that's bad. It's, a logical purpose for it.
Right.
However, they'll refer, if he wants to speak to any of our staff, just like we would, they would give him our number and refer him. But it's great having that 800 number, especially for the older clientele, because if you don't have a cell phone, it's a toll call. So when you look at our 56-town region, if we have people calling from Middletown, which is our area, it makes it difficult for them, depending on which plan that they have. Because some have that, they can only make a certain number of outgoing calls, so they're on restricted plans. So they can call us from any phone, the 800 number, and it will go good. That's really the best. And this way, even if they don't know what they want, we have a wonderful triage system where certain questions are asked. If it's an insurance question, it goes to choices. If it's a caregiver, question, it goes to our care managers, and so on and so forth. If it's fraud, it goes to our information specialist. So we have a little multidisciplinary, it's like the Jacques Cousteau of the Calypso. Well, we have a little something for everybody.
It's definitely something I think people need, and they need it before the crisis hits.
Absolutely.
To get all of that information. And it's nice to know that you don't need to wait until October 15th to be able to call you and ask you questions about the Medicare D.
Absolutely.
Part D,
because
benefit.
People are turning 65 every day. So they don't have to wait for open enrollment because they're in a special enrollment.
Right.
So their needs are a little more different than someone that's been on Medicare for 10 years. So that keeps evolving too. And as you mentioned, changes over time to the Medicare, process and to supplemental plans and, Medicare Advantage plans. That's evolving all the time. So
now your website, would that be something that people should look out to?
Our website, even I can use the website. That's how easy it is. It's www.seniorresourcesec.org. The EC is for Eastern Connecticut.
Okay.
But it's driven for providers, consumers. If you're looking for where the senior center is, we have directories on there. We have a news you can use, which we have on our website. It gives everybody's news, who's doing what and where, and what's the date, time, and location. But we get that from our M teams.
Okay.
So we try to share the wealth.
And they can contact you through the website as well.
Yes, you can. You can leave emails. It gives our contact information. Because if someone is calling us from Norwich, they probably want to use the direct line versus the 800 line.
Right.
So yeah, all our information is on there, and it's easy to use.
Okay. Are there any mistakes that you've seen people do when making choices for their services?
Well, actually, a mistake would be an opinion. What I think is a mistake sometimes is not always a mistake for them. And just to give you an example of that, for instance, people have loyalty to certain organizations, whether it be Anthem Blue Cross Blue Shield or United Healthcare, AARP. I've heard people say this time and time again. They paid my bill. That's what I'm going to say. I don't care if the premium went up. They paid my bill. And it's my job to say, you paid your premium. Because if, in fact, you didn't pay your premium, they wouldn't be knocking on your door wanting to pay your bill. They wouldn't pay it.
Right.
So My loyalty is to the consumer's pocketbook. You know?
Okay.
So, I would tell them that, but if a 90-year-old lady wants to stay with Anthem Blue Cross Blue Shield, and even though it may be cheaper with another one, and she's up all night worrying about it, that is not going to be a good thing.
Mm-hmm.
So we just give them the facts and tell them the myths, because there's myths with a lot of stuff, and let them make their own decisions.
I think just the peace of mind is what helps them determine where they're going to go.
I think so too, coupled with accurate knowledge. It's one thing to know half of something and not know the whole story, enough to be dangerous.
Right.
But when you're coming to someone, and I don't want to, lead anybody to believe we know all the answers. We call the Center for Medicare Advocacy. We call the Connecticut Insurance Department. We call the legal services developer at State Department on Aging. So if we don't know accurately, then we double check to make sure what we're giving out is correct.
And it most likely is correct for today.
Absolutely.
But
things
it could
are going
be
to change
different tomorrow.
Right. Well, and you bring up a good point, like with the supplemental plans. They're not subjected to open enrollment or all these other rules. Down the road, will that happen? Probably. But for today, it's open enrollment all year long because it's voluntary, and if you want to jump in, you can. But could that change down the road? So if somebody heard me say this today, and 2 weeks from now it changed, that's what creates that need for accurate knowledge at the grassroots level.
Right, right.
So we want to promote that.
Well, I thank you so much for
Thank
coming
you.
in. You were a wealth of information and knowledge, and just the idea of knowing that when you walk in your office, there are other offices there, and you reach out to whoever might be able to help the consumer that's walking in the door.
Absolutely.
It just doesn't stop where you are.
That's correct.
And that's great. Again, this is Nancy Lisee
Thank you.
from Senior Resources. Thank you very much for joining us, and I hope that we can have you again sometime.
Thank you. I'd love to come.